Hello, and thank you for tuning in to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And today, just like every day, I'm going to try to get to as many questions as I possibly can. But first, I want to get started by saying hello to you, Mom and Dad, Dr. McDougall and Mary. How are you?
Thank you.
Hi.
We're doing good.
We're good.
Except I'm working really hard, Heather. I tell you, this business of being retired and working this hard, I never thought it would happen. I'm 76 years old. Good grief. But I have
What would
fun.
you do if you retired?
I don't know.
He says that all the time. I should be retired. And we all say the same thing to him. What would you do if you were retired?
But
You would hate it.
I would. I really enjoy it. I have to say, experience has got me where I am today. And I don't think I'm any less good at communicating than I ever was in the past. It's just different. And I guess I take a little bit more time, a little more thought. The experience helps. It really does. Anyway, I was going to try and start out. A couple of weeks ago, we tried to talk about heart disease and, coronary artery disease and, how you treat it. And, I told you there's some different ways to treat it. And, I'm going to kind of touch on things here and there. The first thing you have to understand is that the present treatments for coronary artery disease do not save lives. I think that's really important. I went through the various studies. I got them all because I'm putting together a presentation to my colleagues. I'm putting together a CME presentation where doctors, dietitians, et cetera, will be able to get continuing education credit for taking I'll try to keep it at 5 hours, Heather. I'm having a hard time. I'm probably going to end up 10 hours, but I'll give you, you get credit for every hour that I put into it. Anyway, I've been working on that all day. And today I worked on heart disease. And what causes heart disease is the rich Western diet. What happens is it injures the arteries. The arteries get plugged. They get inflamed. They get atherosclerosis. They get pustules. They get scars, et cetera. Unfortunately, the medical business, all it knows how to do is to treat old, fibrous, hard plaque scars. They're non-lethal. That's what we do with angioplasty. We stick a tube up into the heart, we blow up the obstruction, the plaque, or we put a vessel or an artery, vein, but that bypasses the big blockage in the heart through open heart surgery. But the thing that folks need to understand is what we're doing is we're bypassing hard, fibrous, old, non-lethal scars. And that's why all the studies, I went through all the angioplasty studies. Every single one of them, without exception, shows that this particular procedure where you go and you burst the plaque, even when you put a bare metal stent in, even if it's a drug-eluting stent, it does not save lives. Why? Because you're not treating the killing part of the disease. And the same thing with coronary artery bypass surgery. You've been shown to maybe show some benefit in the really, really, really sick people have really bad hearts. They seem to do a little better. Otherwise, heart bypass surgery doesn't work either. So you're left with the problem of, well, why do you treat coronary artery disease? Well, it doesn't save lives. Current therapy, both angioplasty and bypass surgery can relieve chest pain. I mean, I really enjoyed some of the discussions as to how we relieve chest pain when you do open heart surgery. One thing you do is you cut all the nerves around the heart, and then the heart can't feel anything. Anyway, there are a whole bunch of reasons that people have heart attacks, and then that area of the heart doesn't hurt anymore. There are a whole bunch of reasons that it helps chest pain, but it doesn't save lives.
Well, but maybe that's why, because I think when I hear about somebody having heart surgery, usually I think about them saying afterwards, "Oh, I feel better now that I had the surgery."
Oh,
well, that's what I read.
Well, you read
I read these in articles that people have had heart surgery. Well, they're really glad they had the surgery because they feel much better now.
It's like they're glad to have their breast amputated and all kinds of other things.
They're cured.
Yeah, well, I know.
So, but I never thought about that you would be cutting the nerves. So maybe they do feel better.
Well, they could feel better. Yeah. And besides that, after you go through that kind of aggressive therapy, you all of a sudden get religion, and you start thinking about how you live and how you eat. So maybe that's why, as people change their diets. But there are a whole bunch of excuses. But clearly, these procedures don't save lives because they're operating on a bunch of scars, non-lethal fibrous plaques. And every single study shows the same thing. There are no exceptions. So, you have to decide, well, what's the reason to do heart surgery? Well, if you have a heart attack and you can get to the emergency room really quickly, like within 90 minutes, you're preferably in the operating room within 90 minutes, then they can stick catheters in your heart. They can put blood clotting medicine, blood thinning medicine on the blood clot, and they can dissolve the blood clot and maybe keep you alive longer, maybe save some heart muscle. So if you get there within 90 minutes, that's good. But how about people who don't, say, get there within, let's say, 6 hours of the heart attack? Well, by that time, the heart muscle's dead or the clot's organized. There's no survival benefit at all. So we call that chronic coronary artery disease. So, acutely, you want to take advantage of the heart surgeons. Long term, you say, well, if it doesn't save lives, none of the procedure shows it doesn't save lives. Why should I do it? Well, the excuse is that you should do it to relieve chest pain. Well, the standard procedure goes like this. The indication for heart surgery is incapacitated chest pain unrelieved by good medical therapy. And that's where I think I can go to the slides here and share with you what good medical therapy is. All right, so common knowledge is drugs are the best way to relieve chest pain. And that's basically what most doctors have in their armamentarium. There's a lot of medications. See if we can get this up without any problems. That's where we had problems last time. All right. So I'm putting together this whole new presentation, Heather. You're just starting to look at it, the 5 CME credits. And I've decided I'm going to call it McDougall's Medicine, a challenge and second opinion. Common knowledge as drugs are best to relieve incapacitating chest pain. Well, I'm going to have to change this because common knowledge is really surgery is the best way to relieve chest pain. And both do. But the drugs, are somewhat effective, and they're what you're supposed to do. The doctor's supposed to do for you first, because heart surgery doesn't save lives. I've got to keep emphasizing that. It doesn't save lives. So it does treat symptoms. All right. So how are you going to treat symptoms? Well, you can give calcium channel blockers. You can give beta blockers. You give nitroglycerin. Those are some of the drugs that we use to relieve chest pain. It works pretty good. But I also want to put a caveat in here, and it's like the next 2 pictures you see. There's a picture of me walking my dog, Bodega, up in the back of my house. If I got chest pain while walking my dog, guess what? I'd stop walking my dog because I don't really have that much fun walking the dog. So it's not incapacitated chest pain. But here's a picture of me on the North Shore of Maui going 34 miles an hour on an 1.5-inch piece of plastic, windsurfing. I would call that incapacitated chest pain. I would do something. Well, the first thing you do is change your diet. We're going to talk about that in just a second. First thing most people do is unfortunately they take a bunch of medications like calcium channel blockers, nitroglycerin, beta blockers, and so on. So you decide whether it's incapacitating because it doesn't save lives. You don't want to go through surgery that could hurt you if it's not going to be a benefit to you. All right. So the best way to relieve chest pain is this, and I want to go through some of the research with you, and I tried to do this a couple of weeks ago. The most powerful thing there is what you eat. And you can actually measure the effects of your diet using one of these little machines. You can buy them for like $27. It measures oxygen tension, it measures your pulse rate, really inexpensive. Well, what we find is when we feed a high-fat diet is the oxygen tension in the blood goes down between 5 and 15%, maybe as high as 20%. The blood sludges, you get chest pains. Now, here's a picture of what happens when you eat fat. The fat, not just animal fat, but vegetable fat, it coats the blood cells. Now, here you see the pictures of the blood cells. They're bouncing off each other really rapidly, good flow. Then you feed the meal and the fat coats the cells. And now they don't repel each other. Instead, they hit, stick, and clump. This is called rouleau formation. A tremendous sludging of the blood throughout the entire body. And when it sludges like this, you drop the oxygen in your blood, you get chest pain. So, that's what happens. Here's some pictures here of these kind of studies done in people. Moving along here. Oh, by the way, the blood sludging returns after about 6, 8, 10 hours. And I do want to emphasize, vegetable oil causes the blood to sludge more severely and longer than does animal fat. All right. So anyways, that's how you get the chest pain. And here's another picture. some good research I want to talk to you about. This is a work done by a fellow by the name of Meyer Friedman. And he and a guy named Peter Quo got together and they set up an experiment where they looked at the whites of the eyes where you can see the blood vessels. And you see the blood vessels before any meal. Lots of good circulation, right? You can see that. And then this man is fed, this is a relatively healthy man. He's a typical American guy. He's fed a diet that contains 67% of the calories of fat. And that diet was 2 eggs, 4 strips of bacon, milk, cream, bread, and 2 pats of butter. One meal. And you see the profound change in circulation that happens on the right side of the slide. You see that here? I mean, vessels have disappeared. And the reason is because you can only see vessels when red blood cells are flowing through them because vessel walls are transparent. All right. Now, multiple studies, and this was done by Peter Quo, and I'm going to show you a whole bunch of research that's done. In this particular study, what they did is they took people who were having episodes of chest pain. They took 14 people. And what they did is they fed them a high-fat meal, just like I showed you. And they caused 6 of the participants to have 14 attacks of chest pain. All right. And these attacks of chest pain, they were correlated with changes in the electrocardiogram. They had nothing to do with the size of the meal, the weight of the meal, the number of calories. It had everything to do with the consistency of the meal. So here you see a graph here on one side of one individual. He's fed the high-fat meal. And here, like 3, 4, 5 hours later, he has 4 attacks of severe chest pain. And you can see the changes in the electrocardiogram that occurred at the same time. Now, what my colleagues will say is, well, this is because the food goes to the stomach and the intestines, and now the blood is diverted to the intestinal tract away from the heart, and that's why you get chest pain. Well, they proved this wasn't the case by feeding this and the other individuals a meal that was the same amount of calories, the same size, but was low fat, high carbohydrate. They didn't get any chest pain at all. So anyway, we've known forever that good medical therapy, which is designed to relieve chest pain, must start with a healthy diet because it goes away. Chest pain goes away. Here's multiple studies. You can look them up. Of course, you have access. You know where the pause button. You can look them up, all the individual studies. And here, all this work was done, which proves that the indication for heart surgery, which is chest pain unrelieved by good medical therapy, patients don't get good medical therapy until they do this. And they're never offered this. In fact, they're sent right off to the heart surgery, the angioplasty theater, the bypass theater, not even given a chance to take the drugs.
Do you think it's because everybody thinks that all the newer research has to be better? And so they just sort of ignore the older research, even though the older research shows,
Well,
what they're supposed to be doing?
The best way to answer that, Mary, is people do discount older literature. They usually do it when they don't have any argument. They say, oh, that's all old stuff.
Yeah.
Well, excuse me, these researchers, that were doing the work 50 years ago or 70 years ago, they were smart men and women. They did good research and it wasn't influenced by the food company and the drug companies.
Well, I just noticed that when you showed that
Yeah,
the last picture, they're all older studies.
Right. Well, here's a newer study. This is done by Dean Ornish in 1983. And what Dean showed was in 24 days, using the kind of diet we recommend, he got a 91% reduction in chest pain episodes. Same thing. Well, that's a pretty newer study. And but you don't see any studies that show this doesn't work. All the studies shows it work. And see, the orientation, unfortunately, is not towards food in our medical education.
Right.
We're talking about drugs and devices, surgeries. We're talking about business. And
So they don't even do any studies on
no, these are all done. They're finished. It's proved. It's history.
Okay.
Yeah. Good question. Okay. Anyway, that's all I'm going to say today, Heather. I just want you to know, again, and this is my series, if you're being cheated, you're being lied to. And that's what the CME is going to be about, is I'm doing 5 lectures. And they're McDougall's Medicine, a challenging second opinion about it. It started with a book I wrote in 1984. And it's going to start out with common knowledge. Like everybody knows you can't get protein from plants. Or plants don't have all the essential amino acids. or everybody knows you should be taking vitamin D pills and shots, or everybody knows that sugar causes diabetes. And so I've got all the lectures, I have them set up so that it's common knowledge. Everybody knows, but they're wrong. And I show you all the literature there, and you can look it up. You go, my goodness, just like you asked, isn't there other research that says or haven't they done more? Or, no, there's no profit in it. So it's just forgotten. In that next section, if we were to go on, maybe we'll go on next week, Heather, I'll show you the studies on reversal of artery disease. It's proved beyond a doubt. But the important thing is what's proved beyond an absolute doubt is that operating on hard, fibrous, non-lethal scars does not save lives. So what are you left with? You're left with a few drugs that may relieve chest pain, or you're left with changing your diet, which is the cause of the problem.
It doesn't seem like there are that many drugs either.
Well, you got
I mean,
nitric.
you don't hear ads on TV about drugs for
Well, how much does nitroglycerin cost?
probably
Probably
nothing.
Beta blockers, they're generic. Calcium channel blockers are generic. Once a drug goes generic, it's not only is it not promoted, the spin doctors get after those old drugs and convince my colleagues that these drugs are useless. No, it's not just selling the news crap. It's a matter of you gotta get the doctors to stop prescribing the old crap. Like for example, digoxin, great drug for atrial fibrillation and heart failure. Just an amazing drug. An herb that's been around for 800 years. It comes from the foxglove plant. I actually, when I was a young student, I used to prescribe foxglove leaf. It would come in a sheet of wax paper. And it was just the foxglove leaf
Foxglove.
Yeah, foxglove.
Foxglove.
Thank you very much. I keep her from the English language. Foxglove leaf, glove leaf. Yeah, foxglove. You're right. I used to bring in a piece of wax paper with.
Had a real leaf in it.
Yeah, it was really
Well,
dry.
how could you tell how much drug was in one leaf?
Well, the pharmacy extracted it and weighed it, but that's what and then of course they came out with digoxin, which was the synthetic, and none of us prescribe the leaf anymore. And of course, I understand why it's less convenient and as you may, less reliable in dosage. But then what happened is we had this long history of using digoxin and digitalis leaf, from the foxglove plant. We have this 100-year history of using it. Well, calcium channel blockers came along, and the spin doctors were hired by the manufacturers of calcium channel blockers, which were then brand name. They had to tell the doctors not to prescribe any more digoxin. That was bad therapy. Forget, yeah. And then once the calcium channel
doing that with calcium channel blockers
and beta blockers, you got to get the doctors to stop prescribing the older stuff so they have a market for the new stuff. It's like the new diabetic drugs or the anti-inflammatory drugs for rheumatoid arthritis. Is they just push this garbage at the public, and they can charge unbelievable amounts of money. If you're a patient.
and then do unbelievable amounts of damage.
The truth is the truth, okay? And it doesn't change. Unfortunately, my colleagues have not been taught about diet therapy. Some of you know about SB 380, which I got passed as a law in September of 2011. Jerry Brown signed into law SB 380 of California. Look it up. Look up SB 380 California.
That's only for California.
Yeah, it's only and it was a law that was written to force our 11 medical schools to teach diet, teach what the human being eats. And the 500 noontime lectures that are at our different hospitals, we were supposed to, based on this law, we were supposed to have education on human nutrition. Well, that was 12 years ago, and little has changed, but some has changed. But medical students are still taught extremely little, except as you're going to pipe in here, Heather. Except, tell them, Heather.
Well, in our 12-day online course, we educate medical students and residents. Every program, we take 10 residents, put them through the whole 12-day program. They sit in with patients and really see how powerful food as medicine can be. So doctors are learning out there, just a few of them.
But there's, anyway, it's not as profitable. That's part of the problem. But I think most doctors went into, I know that most doctors would be happier having happy patients than being rich. I mean, you can only get so much money, but there's not enough happiness that you can get from a practice that's satisfying your patients. I mean, the reward is huge compared to, the bits of financial reward that we get from basically lying to our patients and mistreating them. Anyway, that's the series I'm going to do. I'm going to do 5 CME lectures set up that way. McDougall's Medicine, a challenge to second opinion. Common knowledge. This is common knowledge. I'm going to show you that it's wrong. And we're going to go through it and hopefully, and by the way, I want to add one other thing here, and I never talked to you about this, but we have a 501c3 tax deductible foundation, which pays for any expenses that medical students have that come to our program. And of course, there used to be considerable expenses when they travel to the live-in program. Now the expenses are less. Plus, the 501c3 is going to pay for the promotion of these 5 CME hour lectures to my colleagues. I think what we're going to do is we're going to ask them to make a donation to the foundation for getting the credits. Otherwise, the credits are like $3 to $10 an hour. Doesn't sound like much, does it? But some people, it would be a big deal to them. So we're gonna give them away for a donation, and the foundation is going to help pay for that. But anyway, if you got some extra money under the mattress, we have no hesitation to donate into our 501c3 tax deductible foundation. It's been in existence for over 20 years. We're not just a temporary organization. We've been around a long time.
Well, no, and you mentioned that we're having medical students. We used to only be able to take 2 at a time. And now we can take 10 at least. And so we're getting the word out to more of them now than we used to be able to.
Yeah. Well, the American College of Lifestyle Medicine, which is an organization Mary and I helped found in 2004, they've got nearly 5,000 members of doctors who are interested in doing things right.
Yeah.
And the same thing with the Plantrician Conference, which I'm getting an award at, a luminary award. You got to explain to me what a luminary award is.
I don't know.
You don't know.
Sounds good though.
But I'm getting one. And there haven't been very many giving out. Anyway, in September, I'm getting the Plantrician Society, which is
just those 2 things though. The Plantrician base and the American College of Lifestyle Medicine. Yeah. Look at all those doctors that are interested in helping people.
Yeah.
So there are some.
And I think if they got the foundation, the ammunition, I've done all the work for them. Anybody who wants to contest with people who practice, the kind of medicine that we don't believe in, the drug, device, and surgery for everything. Anybody who wants to go up against anyone who takes the trouble to mildly educate themselves based on the slides that I put together, you're going to win. The truth is the truth. The data is overwhelming. It's not like, well, you got studies on this side that say one thing, and there are other studies that say something else. They tell me that all the time. And then I looked up the studies and I found out, no, they don't. You can lie a little bit if you're good, and many of these doctors are good. But I know how to catch them. I know how to read the methods. I've been at this for a long time, for like 55 years. So. After that many years, you kind of figure out how they cheat. So you want to beat them, the guys who are recommending all the drugs and the devices and the surgeries. I guarantee you'll beat them every time. All you got to do is take a few minutes reading the research and understanding what I have to say. Just like I told you about heart disease. We'll go on, Heather. You want to ask some questions?
I have so many questions coming in, and I'm going to get to a few on heart disease first. So this one's from Tanner, and he wants to know what you think about the calcium heart scans.
Well, that's interesting. Calcium, the way that tissue becomes inflamed is if you get an injury, say a sliver of wood stuck in your hand, or you have an injury of your tendon or your bursa because you're hammering or something. Okay, when you get injury, what happens is the result is inflammation. Remember, inflammation is not the cause. Inflammation is the result of injury, like the fork and spoon or burning yourself with a cigarette butt. Okay, that's the injury. the response is inflammation, which is swelling, redness, pain, and heat. Okay, so that happens initially. Then what happens is if inflammation continues, the body lays down. Well, first of all, it calls in a whole bunch of white blood cells and inflammatory reaction cells, and they make a pustule in the area of damage. So you get a sore, and then white blood cells fill in. And then what happens is it fills in with scar tissue. And in that same process, at the end of dealing with inflammation, it lays down calcium. Let me give you some examples where chronic inflammation lays down calcium. If you have a tendonitis or a bursitis, and a doctor takes an x-ray of your tendon or bursa after many years of it being inflamed, the doctor is going to see calcium in the tendon and bursa. If you have tuberculosis, the classic sign for tuberculosis, infections all over the lungs was miliary calcifications. In other words, thousands of little calcium deposits in the lungs. You get inflammation in your breast ducts. And what the doctor will tell you on a mammogram is, ma'am, you have calcification of your ducts. Well, that's from chronic inflammation of the ducts from the food you ate. So anyway, the diet, the rich Western diet, damages the arteries by a whole bunch of mechanisms, some known, some not. The result is inflammation, which eventually leads to scar tissue and the deposition of calcium. This is the end stage of inflammation, of chronic disease. It's the end stage. It's old disease. It's that hard, fibrous, non-lethal plaque that I was talking to you about, which doctors operate on. But it's stable. It never bursts. So you've got this calcium in these old fibrous lesions. Well, you get a calcium scan done, a heart scan done. Well, if you've been eating an unhealthy diet and you are the kind of person that's susceptible to heart disease, atherosclerosis, then you're going to see a lot of end-stage calcium deposits. But that's the way you used to eat. But the way you used to eat is probably the same way you still eat. And that's why there was a correlation between calcium deposits and your risk of dying of heart disease. But what if you had a heart scan? Like I did. Remember that day?
I remember that day.
Well, my brother is a physician, and about 30 years ago, he was working in an office where they had a CAT scanner that measured calcium deposits. And Mary and I, it was free, decided to have it done. But see, I would recommend you not do it. I at least knew what was going on because you might get in trouble. You flunk the heart scan, and the next stop is the heart surgeon. Believe me. Anyway, we went in there, we had our scans done. The technician, I'll never forget. She said, well, I'd like to talk to Mary first. Well, Mary, you have a perfectly clean heart scan. Now, I've been living together for 20 some years, eating the same food. But, I have this history of having a stroke at 18. I had a cholesterol of 338 when I was 22 years old. I ate worse than you. No question. Anyway, she calls me aside. She says, I got terrible news for you. Yeah, your calcium score is like close to 300. You're in big trouble. And I said, well, okay, let me think about it. Of course, her recommendation was to see a cardiologist, a heart surgeon.
Yes, I remember that too.
You remember that
Right
too?
away, she said.
Before you die, you won't make it out of the office doors unless you make an appointment with a cardiologist. Then you can leave. You're safe. Anyway, you see, my thinking was this. Remember, this was 30 plus years ago. My thinking I ate horrible when I was a kid growing up. I had a stroke, the cholesterol 338. I used to eat bacon and eggs for breakfast every morning, steaks for lunch and dinner. Like you, like some of you, most of you. But I didn't do that anymore. So I figured that if I stopped injuring the arteries, they'd stop getting sick. But the sickness that was already there, the old scars and calcium aren't going to go away. If I had a scan done today, my guess would be my calcium score would be very similar. But I'm 40 years from that event. I just recently got off my windsurfer. I showed you some pictures, didn't I? Yeah. All right, I could be out 4, 5, 6 hours a day on that board without an inkling of chest pain. Not worried about it. I'm not going to have a heart attack. Anyway. Be careful. Be careful what you ask for, because you may end up with an angiogram and then an angioplasty and then bypass surgery and brain damage. And You just bought a whole bunch of therapy that did you a whole lot of harm and cost you a whole lot of money. But you're not going to do that because you're going to take the trouble to read the research and take the trouble to figure out how to look it up, which I've told you before. I'm just going to tell you one more time. And that is there's a website called Sci-Hub, SCI-HUB. And you can find pretty much any article that's published in medicine. Now, some of the newer ones aren't there, but they're mostly open access, so you can get them other ways. So you go to Sci-Hub and you ask Sci-Hub for the article. And you put in what we call the Digital Object Identifier, DOI. Put the DOI in there, it pops up free. You get pretty much everything I tell you, all the references, the bottom right-hand corner of my slides, which I meticulously put there, you can read the original papers. And you can find out whether I'm telling you the truth or exaggerating. That's too much on calcium, right? That's more than I should have said.
Never. Okay, lots of questions coming in about heart disease, so I'm going to stick with that for a little while. Tell It to the World has a question. They have a mechanical aortic valve and would like to find an alternative instead of taking warfarin.
That's tough. I don't think I have one. But, you know, I
Is
think,
there some better ones than Warfarin?
well,
now?
I don't know what they're prescribing, Mary. It's kind of hard for me to keep. She has a mechanical valve, like a
I
Starling
know
valve.
that, but I mean, I think, I know you need something like Warfarin. I was just questioning.
Eliquis.
Yeah, isn't there something
Well,
better than
They
Warfarin?
advertise, I think Eliquis says it's for non-vascular heart disease. But
Well, it's just me.
you know,
Whenever I hear the word Warfarin, I automatically think of rat poison.
yeah, well, it
And
is.
it really, I just think, isn't there something better that they come up with instead of rat poison?
No, I don't think so. These mechanical hearts are really, really something. There's something called the Starling valve, which I've been in several surgeries on, where there's a ball that goes up and down in a tube and clink, 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 clink. I don't know if that's the kind of mechanical valve you have, but phew, that drives me crazy. Anyway,
Yeah, but they're miraculous.
oh yeah, but you know, there's newer valve surgeries now which use pig valves and well, mostly pig valves and cow valves, and they put them through. They actually don't even have to open the chest. They actually put them through the leg.
Really?
So amazing what modern medicine can do. If you need modern medicine, don't turn your back on it. Just don't let them give you the wrong message, which is too often done. So no, I don't know of an alternative, but I do know you should be on a healthy diet. I'll tell you why. Because you take the workload off the heart when you eat a healthy diet. Remember, I showed you the sludging of the blood just a couple of minutes ago. You can imagine all your circulation, your brain to your toes, is all sludged up like that. All, you know, well, how much work do you think the heart has to pump the blood into your toes? That's a lot of work. So you need to reduce the workload on your heart, and you can do that best with a good diet. And the other thing is what you eat in terms of animal versus vegetable fat determines how thin your blood gets, how anti-clotting it gets. So you have to be careful not to add extra vegetable fat because it'll thin the blood and add to the warfarin breeding problem. And you have to be careful about animal fats because they are counteract the warfarin. So just get on, you know, I'm sure you're going to check it out with your cardiologist, but, you know, from my distant place, I'd say get on a healthy diet. Ask your cardiologist if there's any other blood thinning drugs. Don't let your doctor talk to you about what a right diet is, and then adjust your pro times, which I'm sure you do every 2 weeks. You adjust your pro times based on the diet you're on. You know, they say eating vegetables will change your pro times because vegetables are full of vitamin K. And rat poison is anti-vitamin K. But I never see it happen. You know, I put people on a high vegetable diet who are on Coumadin, and I check their pro times. I never have to make an adjustment. But that's what you're told. Oh, it's you don't want to eat that vegetarian diet. It's just too hard. And those vegetables, they're full of vitamin K, and they'll just ruin the rat poison, the Coumadin, the warfarin. So you shouldn't be eating those vegetables. Well, excuse me, those vegetables will save your life. And you can just adjust your dose of Coumadin very easily. You get on a good diet, get a pro time, adjust the dose of the Coumadin. You know how to do that.
Thank you. Okay, next question. This is from P2. They would like to know what percentage of artery blockage would you consider putting a stent in?
Well, the official recommendation is 70%. Okay, there are doctors who have been sued for doing artery surgery on arteries that are 50% or less closed. You know, that's criteria for malpractice suit to lose. Usually 70% could be operated on, and it might relieve chest pain. But you see, the circulation doesn't even get compromised until you've closed 70% of the artery. There's no significant hemodynamic changes. It has to do with a bunch of physics laws. So you've got to give above 70% closure before you'd ever even notice anything. You could run a marathon with only 30% of that artery left open. And since it is only for symptomatic treatment, because it doesn't save lives, you shouldn't be having it done if you don't have symptoms, because it doesn't save lives. But say you had symptoms, say you got chest pain, and you decided to do angioplasty or heart surgery, which does relieve chest pain, but by a whole bunch of mechanisms, some not so good. Okay, then you would do it for the symptoms. Otherwise, it's, as far as I'm concerned, it's malpractice to go and operate on 70%, 90%, even 100% lesions in an asymptomatic person, because it doesn't save lives. If there was some of the research that said otherwise, I'd be glad to hear about it. But I've spent the whole day looking at the research again. I mean, I spent a lot of time on this because there's no reason for me to be criticized. You know. Anyway, so what was the question? 70%. 70%, 90%. I wouldn't operate on any of them except if you're having symptoms, and that's it. And then I'd have an angioplasty done. If I had incapacitating chest, if I couldn't sail across that pond at 34 miles an hour on my windsurfer, I would consider that incapacitating. So what would I have done? Well, I don't think I can make my diet any better. I would take the drugs. I would take the nitroglycerin, the beta blockers, the calcium channel blockers, maybe not calcium channel blockers. Those are really bad. I would do that. I might have an angioplasty. I might have an angioplasty with a barometal stent. I don't think I'd have a drug-eluting stent, and I'd quit the sport before I allowed them to do bypass on me. Why? Because essentially everybody who's attached to that heart-lung machine suffers brain damage. You know, I was just going through the research on that again. Boy, did I work hard today. I really worked hard on heart disease. I was just going through this research today, and post-bypass surgery, 4 years after surgery, 52% of people have a reduction in their thinking by 20% because of the brain damage caused by the surgery. Another study done doing MRI tests to show damage that occurs during the heart surgery. They found like 36% of people had significant declines in their function at 3 years. You suffer permanent brain damage if you go on that heart-lung machine.
They never tell you that.
They never
tell you that.
Hey, this is
I know.
This is a piece of cake. All you have to do is give me $300,000. I'll put you to sleep. You'll never know what happened. And the chest pain will maybe be gone. But I guarantee you one thing. If I tell you that you never have to come back here again, if you eat a healthy diet, I bet you'll do it. Because there's nothing like having your heart exposed to stale operating room air for about 4 hours to get you convinced that you ought to change your evil ways.
I don't know about that.
Well, you know, the problem is you end up in the intensive care unit. Here you are laying there. You just almost died from heart surgery. And your general doctor comes in and says, you know, how you doing there, George? And, well, doc, how am I doing? I just had heart surgery. I don't ever want to end up here again. What can I do? I'll do anything. I'll eat cardboard, anything to end up here again. The doc looks down at your lunch plate and, boy, you got a good looking cheeseburger here. You know, you better eat your protein to make sure that wound heals. A teaching moment. You know, if they walked in and they said, look, this is a disease that's 100% preventable with a good diet, started young enough in age. This is a disease that's reversible. This is a disease that you can get rid of the chest pain easily just by changing the diet, which is the indication for heart surgery, because heart surgery doesn't save lives. Did I mention that before? Will you check me out? Will you take your friend, your relatives, or the cardiologist and run through the research with them? If I missed anything, I'd like to hear about it. Okay, Heather.
Okay, next question. Let's see. This is from Cynthia. She wants to know if it's possible for a patient with congestive heart failure to get off Lasix.
Yeah, sure. We do it all the time. All the time. When I ran the program at St. Helena Hospital and at the resort, yeah, all the time. So how do you do this? And again, I don't know what your specific condition is, and this may not apply to you, but let me tell you how I do it with patients. And this is not just a few patients. This is a lot of patients I've taken care of. Is the first thing I do is I make sure they have a scale. And what I have them do is I have them get up every morning and weigh themselves in the same condition. In other words, after bowel movement, before breakfast, etc. So they can get a body weight. Write it down, okay? And then we'll reduce your dose of Lasix. And if you gain like 4 pounds after reducing the dose of Lasix, then we're probably too aggressive. But if it stayed the same, your weight, or it's even less, which it almost always is, then we'll cut it down, say from 80 to 40 to 20. In other words, we'll reduce the dose, check the body weight, which is fluid. Okay, that's what you're measuring, fluid. That's what the Lasix does, is it excretes fluid. So, with the change in diet, the low salt, the good circulation, the better heart strength, you're going to have different demands, and the edema is going to go away.
I remember taking care of people like that when we had the live-in program.
Yeah.
When I'd weigh them every morning, there were certain people that had to be weighed every morning.
Yeah.
So you could follow them. So,
And we do that in the telemedicine program now.
Yeah.
It's just that, Tiffany or Tracy or Corey or, and Heather's, of course, always on top of it. We just have you weigh yourself at home. We can do that over the telemedicines. What do you do? Okay, so you gain 4 pounds the next day. Well, you bump the dose up a little bit. But that's not what's going to happen. If you change from the Western diet to the kind of diet we recommend, you'll have profound reductions in your medication. And most of the people we get off all Lasix, and even the most severely sick ones, they go home taking 10 milligrams of Lasix, maybe 5. That's it. Yeah, this is easy. Give me a hard question.
Okay, let's move on to some different topics now. I think we did a lot on heart disease. This is from Johnny, Utah. He wants to know your short answer for how long it takes to reverse the effects of a poor diet for someone that's been eating this way for the last 50 years.
All right. It takes 4 to 7 days to start the reversal. Why? Because you have to clear your bowel of the bad food and the remnants of that food. So in 4 to 7 days, usually within 3 days, we see profound drops in blood pressure and blood sugars. Now, not initially. Your blood sugar initially goes up. Why? Because you came in eating nothing or eating an extremely low carb diet, and we just fed you a whole bunch of glucose, sugar. So initially, until you make some adjustments, the first 2 or 3 or 4 or 5 days, your sugars might go up, but they're expected to go up because now you're eating sugar. Anyway, you've got to go through a bunch of healing to go through, and then that happens usually pretty quickly. As far as finally solving your diabetes, you'll have to get down to trim body weight. And whatever that takes, at a rate of about 8 to 14 pounds a month, eating strictly. Add a little exercise, you could bump it up to 16. Watch a lot of TV, you could bump it down to 6, So you end up, you might have 200 pounds of weight to lose. You have to lose that extra weight before you can really see the full dynamics. But if it's the other usual kind of problems, like, for example, autoimmune diseases, rheumatoid arthritis, lupus, if you're not better in 4 months, my message to you is go find somebody else to help you.
but we notice people feeling better, in 4 to 7 days.
Usually,
2 days.
well, the bowel movements are huge. And the diarrhea goes away. Like in 72 hours, the bowels are great. The diarrhea is gone. Stomach pains are gone. The greasy skin is gone within 24 to 72 hours.
I notice people are
Fatigue.
really talking about how much better they feel in 4 days.
You'll notice something on yourself. Within 4 to 7 days, you'll be in the pink. Remember, I showed you a few slides ago. Boy, this was a good introduction. I showed you a few slides ago, the sludging of the blood that takes place all over the whole body. Okay, it takes place in the skin. When the blood is desaturated, the blood in the veins, it is blue and gray in tinge. It's blue. It looks gray through the skin. And then when you eat well, you get improved circulation and the blood cells become red because you have good flow, good oxygenation. And the terminology to use.
That was, I mean,
You know, it's in the pink.
Pink.
people don't know what in the pink means. That was
They gotta know what's, you think it's
that
not
was from
time?
our parents' age. It wasn't even our age.
Really? Did you know what in the pink was, Heather?
Well,
You ever heard that?
but that's only because I listen to you all the time. So I'm not a good person to ask.
You know, you,
Nobody says in the pink anymore.
you
You
well,
have to think about something else. But I think people can relate to it.
all right.
Once you say it, people know
Well, you know,
they know what you mean.
But once you see it, then you'll walk around, you see your
Yeah.
friends and relatives, you go, oh, they do look gray. They do look cyanotic. They look sick. Well, that's because they are sick. And then if you get some of them to change what they eat, they get dramatic improvement in circulation. How fast? Within minutes and hours. You heal real quickly. Okay.
Thank you. Okay, next question. This is from Lou. Can diet have any impact for people suffering from dystonia?
Dystonia, that's like can't talk.
I
Think
don't know.
so.
Figured you'd know.
I think dystonia is you can't talk.
I'll look it up. I'll let you know.
It depends on the cause, Heather. Look, Bystonia. I'm pretty sure it says. Anyway, I you know, probably, I can't imagine any scenarios.
Well,
What?
no. Abnormal muscle tone resulting in muscular spasm and abnormal posture,
Oh, okay,
typically due to neurological disease or a side effect of drug therapy.
well, I guess that's kind of like generalized.
Yeah,
And I think,
yeah, it can affect one or more parts of the body. Yeah.
okay, well, good. I don't know, it depends on the cause. Maybe it's a drug you're taking, like an a lot of the psychiatric medications have these side effects.
Well, here's the symptoms, see, uncontrolled muscle spasms.
Yeah, I think if you looked it up, also I had some trouble talking to you.
Oh, I would think so, because it talks about that.
Anyway, you know, I don't know. I mean, if it's caused by medication, you get off the medication, the answer is yes. But so as far as some direct effect, you know, I'd have to know the cause of dystonia, and I can't relate it to anything but the medication Mary was talking about. Maybe you had a stroke, but that wouldn't offer generalized spasms. So I wouldn't consider that a real positive answer from me. But you should change your diet anyways, even if it doesn't work. It's like, you know, why would you want to have heart disease and be constipated? Even if you couldn't solve the heart disease, you don't want to be constipated. Just fix the food. And by the way, in case of those of you who are new to the show, and hopefully there are a lot of you new to the show, the McDougall diet is a diet of starch. That means corn, and potatoes and sweet potatoes, and rice and wheat, breads and pastas, and that's what it is. It's mostly starch with the addition of fruits and vegetables. Contains no free oils, no olive oil, no corn oil. And contains no animal parts or secretions. That's it, man. It ain't all hard. It's a diet that most people who've walked this planet throughout all of human history have consumed as a starch-based diet. So we're just eating like normal people do and have forever.
Thank you.
Yeah.
Next question. This is a topic that's very interesting to me, and we're actually dealing with this with a neighbor. This is from Leah. Can you please explain what Aldara is and how it acts on the body? Is it recommended for a nodular BCC located near the top of the nose?
Well, it depends on who you're talking to. If you're talking to your dermatologist, no, it's not recommended because it's too difficult to take. And I happen to do a Mohs procedure where I cut little sections of your nose off until you scream "Yo, uncle," until the pathologist screams "Yo, uncle." You know, they end up with big holes in your face. It's called a Mohs procedure. That's what they'll say you got to have done.
You have to describe what Aldara is
Okay,
first.
Aldara is a cream that I've used personally and professionally. I've used it with my patients for probably 35 years. And the reason that I use it is because I got a lot of skin damage my skin got damaged out in the sun. I used to own an ocean-going sailboat. When Heather was like 2, 3, 4 years old, she used to sail all over the Hawaiian Islands with Mary and I. And I spent a lot of time windsurfing and scuba diving, and let's face it, my lily white skin was put through a lot of damage. So I've used Aldara for 35 years. The FDA approves Aldara for the treatment of the following: actinic keratoses, squamous cell carcinoma, and basal cell carcinomas. Guess that covers it. If the FDA says it should be used, then I guess it should be used. Now, if you look up basal cell carcinoma and Aldara, you'll find some very interesting articles. In fact, I can think of one article which shows you pictures of how the lesion, the carcinoma, becomes inflamed. It gets nasty. In fact, you want it to get nasty. You want it to be like poison oak or some inflammation that, so you could tell the body is attacking this cancer. That's what the body does. There are various cells that are activated by Aldara, which attack abnormal cells only. They don't attack normal cells, only the abnormal cells, like those in actinic keratoses, basal and squamous cell. So you can use Aldara. When I first started buying it was like $100 for 12 packages. And at that time, it was used to treat venereal warts in women. And then it was discovered it was just a great drug for sun damage. It went up from like $100 to $1,000. And then it became generic. And then it went down to where you can buy it for between $16 and $50 for 12 packs. Cheap, self-administered, not profitable for your doctor. You will be discouraged from using it. And that is why, and the only reason why, because if the doctor only had you in mind, the doctor would say, yeah, it results in a little like poison oak, and it ain't that bad. It really isn't that bad. But
it can be. If someone has a lot of damage, we had a friend who had a lot of damage on his face. Yeah. And I remember when he used it, he sent you a picture of himself, and his whole face looked like he had poison oak all over his face.
That at least lasts a week or two. It all goes away.
But people have to be warned about that. I think, when we saw a picture of him afterward, it was like, I couldn't believe it. Yeah. Right. So, it's worth it, but you have to warn people that.
Yeah. You don't want to schedule your high school reunion for those particular times.
You're going to put a little bit of that on your nose. Be prepared for a big red nose for a while.
You hope you get a big red nose, then it works. Anyway, my attitude is, look, let's try simple stuff first, like Aldara. And by the way, a low-fat diet reduces the risk of recurrence of actinic keratoses, published in 1992 in the New England Journal of Medicine. Just look it up. Actinic keratosis and low-fat diet. You can't miss. It's right there in Google. It reduced the recurrence of actinic keratosis by 2 to 6 times in those who used a low-fat diet. So there's some dietary implications too. But the main thing is look, if the Aldara doesn't work, there are thousands of dermatologists who will be happy to do a Mohs procedure, some other type of excision, leaving you with the ugliest scars in the world. Sometimes.
And it's not like you have to do it. It's not like if you try it and it doesn't work, it's going to be a big disaster because you had to get it done right then.
No, you give the simple stuff, the effective stuff a try first, and then you go and see the surgeons.
Thank
Come
you.
on. Who would argue with that approach? Good grief. Because that's the only option they have. Well, they have silver nitrate, little silver nitrate sticks. They have liquid nitrogen. And then they have 5-fluorouracil. And then they have Aldara. Well, I tell you, Aldara far beats all of those other procedures. And then after that, you end up with excisions, either the Mohs procedure or, whatever they plan on doing to. But, you end up with big scars too often. But rarely do you end up with a scar by using Aldara. It can happen, but rarely.
Thank you. Okay, let's see. Colleen wants to know if it's necessary to eat green leafy vegetables every day.
No. You can live on potatoes and water, Let's not overdo this, okay? But why do you eat green and yellow vegetables? Well, they add color, flavor, texture, aroma, and some concentrated nutrients. But otherwise, a potato will supply everything you need, including vitamin beta carotene, vitamin A,
Yeah,
and
but
vitamin
we've
C.
all heard so much about green leafy vegetables and how wonderful they are.
I know.
So that's why
Well,
people ask
those
about
people
green
who
leafy
push green leaf, we allow, say, 10, 20% of the diet to be green, non-starchy green and yellow and orange and red vegetables. That's what they are. Maybe 10%, 20%. The other 80 to 90% is starch. Or you throw a little fruit in there, that'd be okay too. But like a potato is called an anti-scurvy vitamin, vegetable, anti-scurvy vegetable. So you don't have to. You asked, do you have to? The answer are how many? You don't have to eat any at all, period. And if you overdo the vegetables, what happens is you don't have enough starch, sugar to make you satisfied. So you're hungry all the time. Good grief, it would take me, I'd have to eat 11 to 22 pounds of cabbage to get in the calories I need every day. I don't have that kind of time. And my stomach would be so grumbly and upset, I couldn't do it. So don't fall into these nutritarian diets, that forget to name it starch. I have to tell you, look, starch-based diets are something that I have emphasized in books. And since I started doing this 57 years ago, I've talked about starch-based diets. And, unfortunately, even my friends have a hard time wrapping their arms around that concept because I kind of own it. And so what they call it a whole food plant-based diet. What's a whole food plant-based diet? Kale and broccoli? That's whole food plant-based. That didn't tell me what to eat. Or maybe I could have an orange and some asparagus. That's whole food plant-based. You are a starch eater. Until you figure that out, you will suffer. You won't get well. You must understand that you are primarily a starch eater, just like your kitty cat's a meat eater. You are a starch eater. And your doggy's an omnivore, eats both, or anything. We are herbivorous starch eaters. That's what we are. And I didn't write the rules. Okay. But I've said it so many times. All large, successful populations throughout all of verifiable history have obtained the bulk of their calories from starch. That means 99.999% of people ever walked this earth got the bulk of their energy from starch. Starch, get over it. Someday I'll have to tell you why I put the picture of the potato and the ruler on the front of my book called The Starch Solution. In the meantime, between now and next week, take the trouble to look at the cover of the book, The Starch Solution, and see what that reminds you of the potato and the ruler. And you can write it into Heather because she won't put it up on screen. But it's how I felt about the people I was writing to is, especially for the people who deny what I have to say, is here you go, folks. You just imagine what this potato and never mind. Go on to the next one.
Okay, next question. Let's see. This is from Irene. She's been following the McDougall program for a while. She started eating a lot of fruit, and that made her cholesterol go up about 23 points. So she wants to know what the biological mechanism is behind eating lots of fruit and having your cholesterol go up.
You haven't given me any singers tonight, Heather. All easy ones. All right. Fruit raises triglycerides. Any simple sugars raise triglycerides, but fruit in particular raises triglycerides because it has simple sugar. Cholesterol runs around a package called lipoproteins. Lipo, fat, protein, cholesterol. So there's these packages that run around the bloodstream that have a central core of cholesterol, and they have a package surrounding them made of protein and fat. Lipoproteins they're called, all right? When you raise the fat, okay, in other words, you eat a lot of fruit, you raise triglycerides, which is the fat part. Then what happens is you raise the lipoproteins and it drags the cholesterol up. That's what happens. Not always, not often, but that's what happens, is you end up making more lipoprotein packages because you raise the triglycerides because you ate a lot of fruit. So what do you do about it? Nothing. People don't die from high cholesterol. They die from rotten arteries. And that fruit is probably an important part of your diet. It's, it certainly shouldn't be unhealthy. So if you're going to focus on cholesterol being the end all, then you're in big trouble. You're following a false god by following cholesterol, or the people who prescribe cholesterol lowering methods as an end all. No, what you want to do is you want the tissues healthy. You want the arteries strong. Cholesterol is an association because cholesterol is in animal foods. And when you eat animal foods, you get a higher cholesterol and you get sick because you're not a kitty cat. You're not a carnivore. So you're so malnourished that you get sick. And your high cholesterol is just one of the signs of you eating poorly. Fix the problem.
Okay, that's great. 6 o'clock on the dot. Perfect timing.
Well, you got to tell us what you're up to the next few weeks, because some of these people, they're long past the time when I know you're going to say it. I should have done this a long time ago. We're getting ready for summer. You got the rest of the life ahead of you. We can, shall we guarantee it? We can almost guarantee that you're going to have the most unbelievable experience in terms of renewing your health and gaining back your personal appearance, which you've lost. We can fix it for you. We can help you fix it. We guide you. And the next guidance is a 12-day program that we're running in July because, well, plain and simple, that's the next one, isn't it, Heather?
July 14th through the 25th.
That's only like a month away from now.
It's getting full. It's getting full. And we'll take good care of you. That I can promise you is we'll take good care of you. Whether you'll get every result you're looking for,
that's up to them.
I'm not going to promise them that.
That's up to them.
That's how bad you are when it comes to us. But then I have a motto too you ought to hear. The sicker you are, the happier I am, because the better I can make you. I hate it when people who come to see me and they say, Dr. McDougall, I do everything you say. Can you fix me? No, you do everything I say. I love it when they come and I say, oh, you can't believe what I had last night for dinner. No, I can. Yes, I can. We can fix you. Anyway, we got that coming up. That'll be fun. Next Sunday. So we've doubled our census on these 5 o'clock meetings on Sunday night, 5 p.m. Pacific time. Every Sunday evening, we're on the YouTube channel. So obviously you're bringing friends and relatives in just to take a peek. They don't have to be threatened. They don't have to feel that we're going to say anything to them. They're not participating. They just watch. You see that Mary and I are Heather. Okay, we're
we're not too scary.
not too scary. And you might even believe what we have to say. You should. You should. If you don't believe now, then look up the science. I gave it to you.
So let's talk about one of the other CME talks next Sunday.
Okay, well, I'll throw up some other stuff. Yeah,
Why not?
why not? I'll be busy.
A little glimpse of what you've been working on. So
I got so much stuff. The problem I have is I just know too much, Heather. I gotta get it all piped down to this. Just really.
He has to condense it all down.
Anyway,
all right,
I know
we'll be busy this week. So thank
It'll
you
turn
all
out
for tuning in, and we will see you all next Sunday at 5 p.m. Pacific. Thanks, Mom and Dad, Dr. McDougall and Mary.
Bye-bye.
Okay. Bye, everyone.
Next Sunday. Bye.